Welcome to the North Carolina Medical Society Spotlight. I'm your host, Sue Ann Forrest. Today, we have a very special North Carolina Medical Society friend with us, Mr. Stephen Nuckolls. Stephen is the CEO of Coastal Carolina Healthcare, and we're excited to learn a little bit more about their success. Thank you so much for joining us here at the Medical Society today. We're thrilled to congratulate you on being first in the nation for quality performance scores under the Medicare Shared Savings Program. Congratulations, but what do you attribute your success to?
Oh gosh, it's many things. It's been a real challenge over the last 5 years, and we've done a tremendous number of things at our medical practice. First of all, just a little more about our group. We have about 45 physicians in our group that operate out of over a dozen locations. And we currently, about 60% of them are primary care physicians. We entered into the Medicare Shared Savings Program in 2012, and we're in the first round of 27 providers. We were also one of 5 of those that were selected for advance payment funding. And what that did was it allowed the federal government advanced us shared savings so that we could invest in our programs and get the program up and running. Since that time, we've really focused on redesigning our practices and doing business a little bit differently than what we've done in the past. We really focus on our quality measures, and we've developed a number of reports that we look at by practice location, by doctor, and it's a very transparent process in that each of the providers see how they're doing. And so when we meet on a monthly basis, both with our quality committee and at the individual departments, we review our quality metrics and we brainstorm for ideas on how we can do them better. And then we go back and try it the next month, and then we come back and see if we did better. If we didn't, then we go back and try something different the next month. And just through that process of continuing to look at the metrics and studying them and trying to do better, we've been able to improve over time.
You think this makes your providers better providers too?
They think so. We've had some discussions early on. I think they were a little more skeptical than perhaps they are today. In fact, several of them were recently talking at a meeting about how much better they thought the care that they provided today was in the past. It really helps to have the additional resources and the additional nurses and other staff in the practices which we didn't have before the start of this program.
Right. And how do you think this moves you closer to the triple aim?
Well, it really it incentivizes us so that if we do better on the triple aim, especially around better patient experience and better patient care and smarter spending, that we do better financially. So it really helps align the incentives, which is very helpful in achieving transparency and achieving the aims of the program. When we're able to pay physicians for giving better care, that's a good thing.
And how has the North Carolina Medical Society played a role in your success?
The North Carolina Medical Society has just been a wonderful partner for us. They helped form the Toward Accountable Care Consortium early on in the early days of the program. And we have been meeting at least I think a couple of times a year early on. The Medical Society has also done a great job with developing a number of toolkits for different specialties that have been very helpful at helping explain the program to different specialists and also giving ideas where to focus efforts and how to help achieve the triple aim.
All right. Well, Stephen, thank you so much for joining us today and telling us a little bit more about your success, and we look forward to hearing from you soon.
Wonderful. Thank you so much, Sue Ann.
Thank you.